Good morning, everyone. I'm Dr. Motahare, and today we are going to discuss a topic that affects a great number of people: dizziness and vertigo. These terms represent very different sensations, and understanding that difference is key for accurate diagnosis and treatment. In this presentation, we'll define both terms and differentiate between their symptoms and explore their causes, and then take a closer look to the most common cause of vertigo: benign positional vertigo, or BPPV. Let's get started. Dizziness is one of the top reasons that people seek medical care. The challenging part for both doctors and the patients is that the term dizziness is very nonspecific. But some people call it dizziness, others may describe it as lightheadedness, and the third might call it spinning sensation. Our first and most important step in evaluation of this symptom is to figure out exactly what the person is feeling. What is the true feeling? The more precise we can define that feeling, the more likely we are finding the correct reason, and then the following treatment options. So let's start with formal definition of dizziness. As I told you, dizziness is a non-specific term that describes a range of sensation. It's often broken down into three main categories. The first one is lightheadedness, also known as pre-syncope. This is a decrease in brain blood flow due to something like standing up too quickly. Second is a sense of unsteadiness or imbalance. You might feel wobbly or unsteady on your feet, like about to fall, but without a spinning sensation, no spinning sensation. And finally, there is a very vague, non-specific dizzy feeling. People might describe it as feeling swimmy or fuzzy in the head, disconnected from the body. Now let's move on to vertigo. This is a crucial term to understand. Vertigo is not a general feeling of wooziness. It's a very specific type of dizziness defined by a false sensation of motion. When someone has vertigo, they feel like either they themselves are spinning or whirling, or that the surrounding environment are spinning or tilting around them. The feeling is often described as being on a merry-go-round or having a whole room suddenly start to rotate. This distinct rotational sensation is what separates vertigo from other forms of dizziness. In vertigo, we have a sensation of everything is moving around us, or we are spinning. This is a completely spinning sensation, not just a feeling. Let's put these two together side by side to highlight their key differences. For general dizziness, the sensation is often vague and non-specific, like lightheadedness or imbalance. It can be triggered by a wide range of factors, from dehydration to low blood pressure to certain medications. On the other hand, vertigo is very distinct rotational spinning sensation. It's often triggered by a specific event, like a change in the head position. And it's also frequently accompanied by other symptoms, like nausea, vomiting, or nystagmus, which is involuntary rapid eye movement. So what are the differential diagnoses of general dizziness? We need to consider a very broad range of potential causes. It falls in the many different categories. We have cardiovascular causes, such as a drop in the blood pressure when you are standing up too fast, or irregular heartbeats. There also can be due to neurological problems, such as transient ischemic attack, also known as mini stroke, or more serious conditions like multiple sclerosis or Parkinson's disease. We also have psychiatric causes such as panic attack, anxiety that can lead to lightheadedness through hyperventilation. This can cause lightheadedness. And there are also many other causes like some drugs, some medication side effects, anemia, and also dehydration. Now, when the symptoms are true vertigo, the diagnostic process becomes more focused, and we can divide the causes into two main categories: peripheral vertigo and central vertigo. Peripheral vertigo is the most common type and originated from the inner ear or vestibular nerve. Example of peripheral vertigo includes benign paroxysmal positional vertigo, which we'll discuss more later. Meniere disease, which is characterized by vertigo, hearing loss, ringing in the ear, which is called tinnitus. The other one is vestibular neuritis, an inner ear infection that causes sudden severe vertigo, or labyrinthitis. This is again another infection of inner ear, which is mostly viral. Central vertigo, on the other hand, originated in the brain and often is a sign of more serious conditions. This is a problem in the brainstem or in the cerebellum. This is a less common but more serious one. Okay, causes can include a stroke or multiple sclerosis or even a brain tumor. We should look for red flags when we have a vertigo, such as double vision, facial numbness, or severe headaches, or many other red flags to rule out central vertigo. It's very crucial to differentiate central from peripheral vertigo. Today we'll focus on the most common cause of true vertigo: benign paroxysmal positional vertigo. The name tells you everything. It's benign, so it's not life-threatening. It's paroxysmal, so the episodes are sudden and brief. It's positional, so it triggers by your head position, changing your head position. And it's vertigo, so the sensation is vertigo. So what causes it? Why some people experience benign paroxysmal positional vertigo? Inside your ear, you have tiny calcium carbonate crystals, or ear rocks. They sit in a chamber which is called utricle. When they dislodge and fall into some other place, which is called inner ears semicircular canals, when you move your head, they roll around and send confusing signals to your brain. So there were some ear rocks in somewhere that detached from that side and fall into the another place, that their movement send the wrong signal to the brain, and it will cause the spinning sensation. Okay, the main symptoms include sudden brief episodes of spinning sensation. You can feel that you are spinning or the room is moving. Okay, this episode usually lasts only a few seconds or minutes and are triggered by a specific head movement. For example, when you roll over in the bed, looking up, or bending down or from one side to another side. The symptoms triggered by head movement. Okay. Some people may feel unsteady, nauseous, or even vomit during the episodes. Between the attack, many patients are completely normal, no problem. But they are just worried about that they may experience the episodes again because they are so disturbing episode of vertigo. Fortunately, benign positional vertigo is not only the most common cause of vertigo, it's also one of the easiest to diagnose and treat. The gold standard for diagnosis is a physical exam. The doctor will do some maneuver, which is called Dixhall Pike, in the office easily, and will jump to the diagnosis. The doctor will rotate the patient's head in a direction that causes vertigo. At the same time, the doctor will look at the patient's eye movement, which is called nystagmus, and the diagnosis will be confirmed. Fortunately, there are treatment options in the same manner which are very easy and non-invasive. Doctors will do some other maneuver, physical maneuver in the office, just moving the head from one side to other side and with a special pattern, and help the rocks go back to their home. It's mostly effective, but sometimes really it takes time to all symptoms be resolved. Actually, there is no medical treatment for this problem, but sometimes we use some kind of medication to control the other symptoms like nausea or vomiting until this rock will be in their place. But these physical maneuvers are very, very effective and can lead to very rapid treatment. To summarize the key points from our discussion today, remember, not all dizziness is the same. Careful history helps distinguish vertigo from other causes and between peripheral and central etiologies. Benign positional vertigo is the most common and treatable type, but proper diagnosis and management should always be guided by a healthcare professional. Thank you for your time and attention today. I hope this session helped clarify these symptoms. If you've ever experienced them, remember that recognizing them and seeking a proper diagnosis is the first step toward relief. Please leave your question in the comments and stay informed, stay healthy. See you in the next video.